My name is Stewart, and I'm a senior Koori man from the Perouse community. So I'm a member of the Eora Nation, the Bidjigal people, and my tribe is the Bidjigal tribe. I'm here visiting the National Centre of Indigenous Excellence today, and I've been asked to share part of my journey and what it means to me today to be living with a chronic disease and how I'm able to live more healthy at my age of 64. I've been a smoker for many years. I first started smoking when I was 15 years of age, and I've been quit for 20 years now. I'm glad that I made the decision to quit smoking, but I have to say that it wasn't easy for me. I had a long journey with smoking. But let me say, I always had this fear of developing cancer. Having been a smoker, I always had this fear that cancer might loom into my life, but I did nothing about it. When a health crisis came in my life, I decided I had to see a doctor, and the doctor arranged for me to have a health assessment. Now, a health assessment is more than just sitting down and talking with the doctor and having your blood pressure taken. And when I sat down with the doctor, I had this fear in the back of my mind that it might be cancer. I had some symptoms and I'd lost a lot of weight. And when the doctor said to me, "Mr. Stewart, you don't have cancer, you have diabetes," I actually smiled. I was relieved. And the doctor was surprised. He said to me, "Mr. Stewart, diabetes is a very serious disease." And I said, "Oh, well, I always thought I might have cancer." So the doctor then explained what having diabetes could mean to me, what risks I was at for other chronic disease. So I found out that I had heart disease. I found out that diabetes can affect other organs of your body. It's not just about having a high blood sugar. And understanding more about diabetes enabled me to make some positive decisions about my love affair with sugar. It's still been a bit of a journey, but I feel healthier today because the meds that I take every day have stabilised my health. I feel I have more control over my life. I feel that I have more stamina, and I'm able to work full time. I'm an educator with the Aboriginal and Torres Strait Islander Cancer Prevention Team at the Cancer Council of South Australia. The central point of my message is I would encourage you today to have a health assessment, because I had symptoms for a long time before I realised, or before I was diagnosed with diabetes. And we all like to live a long life. I guess I'm more fortunate than a lot of our people. As I said, I'm 64 and I'm living an active life. If I can encourage you with that message, it gives me a lot of satisfaction to know you'd be influenced to have a health check.